My name's Christian Gosvick. I'm a PGY4 geriatric fellow at the Christ Hospital and just graduated from the family medicine program this past year. I grew up in Northern Kentucky, went to undergraduate at Xavier, stayed in Cincinnati for medical school, worked a lot in nursing homes in high school and college, and that's really what pushed me to medicine and figured out the family medicine piece sometime in medical school.
Hi, so I'm Michael Putnam. I'm one of the inpatient attendings here at the Christ Hospital UC Family Medicine Residency Program from Chicago. And my wife and I have two beautiful children, ages 3 and 1, who are a complete handful. And I also precept in the outpatient clinic as well, so you'll see me both on the inpatient and outpatient side.
My name is Eric Cooney. I'm a recent graduate of the program.
Hello, my name is Mary Barassa. I was formerly known as Mary Mattern in the Family Medicine Residency. I'm from Attica, Indiana, which is a small town on the Indiana-Illinois border.
Hi, I'm Dr. Anissa Shomo. I am a graduate of our UC/the Christ Hospital Family Medicine Residency. I graduated in 2013. I did a fellowship in geriatrics, so I've been practicing for 6 years now.
So I knew coming into family medicine that I always wanted to do geriatrics, and so I'm doing the geriatric fellowship here at the Christ Hospital this year.
I am currently a palliative care fellow here at Christ Hospital. It's a 1-year fellowship, and it gives you training in inpatient palliative care as well as inpatient and home hospice to be able to do that going forward.
The job I took after graduating was with a primary outpatient family medicine clinic in Milford, Ohio. It's on the outskirts of Cincinnati. I picked that because it was about as close rural as I could get with still being in the city here in Cincinnati. Along with my outpatient clinic that I do 5 days a week, about once a month I work in the prenatal clinic down with the family medicine residency, and I precept there. And then now twice a month, starting in November, I'm going to be doing precepting with the family medicine residency at their clinic.
So I work for the Cincinnati Health Department. I am considered to be in the global health division doing that, and we take care of underserved populations. I also do participate in global health abroad as well. So I go to Haiti usually once a year, and I've been 8 times. Sometimes residents come with me, but often I go by myself, whether residents are coming or not. I enjoy it either way, whether the residents come or not, but I really just enjoy going every year and having that continuity with my patients in Haiti and with the other doctors who I've met in Haiti.
I think that the residency did a great job of preparing you for a lot of different paths, and for me that was a geriatric fellowship. And I think it helped that we had good geriatric learning throughout residency. The strong connection up at Maple Knoll Village provided a great nursing home teaching site. We have a number of good geriatric faculty on our inpatient service and available to teach and mentor. So it was kind of a natural and easy transition from residency into fellowship. I'm definitely glad that I chose this residency program. It was my top choice and certainly was an excellent education, wonderful opportunities for mentorship, as much or as little involvement in research and quality improvement as you could want, working in an excellent hospital with great nurses, and an amazing set of colleagues. I really couldn't have asked for much better.
I think the residents prepared me very well for life as an attending. I'm just over a year out into my career now as an attending, and in all humility, I look stuff up every day. I'm still constantly learning. But goodness, it is surprising when you're out practicing on your own. Every day it's like, I got this. And it was really neat to see that first fall after I was done with residency, where you check in with colleagues, is this how you would approach it? And you realize, like, I got this. So with that, knowing that being a physician is a career of lifelong learning and continuing to read about your patients, goodness, this early on in my career, it is surprising how comfortable you can feel just a year in. I feel very well prepared.
So the residency prepares you well for whatever you want to do after residency. For me, with fellowship, I was able to connect with the people I need to in order to apply for fellowships, and get support from multiple parts of the faculty and program in terms of that process, but also they give you a lot of time to do whatever you're interested in, whether that's elective time directly with it, going off and doing stuff to learn more about something. And because it's an academic program that has a culture of going off and learning more things and challenging yourself, which I think makes a good fellow applicant. I'm really glad I went to Christ Hospital Family Medicine residency. It's a little bit biased because I did meet my wife here in Cincinnati, and I wouldn't if I hadn't come here. But also, I felt like this provided me, looking back, this experience provided me with great clinical experience, great connections here in the Cincinnati area, and a diverse training population, whether at the hospital, clinic, the free clinics, and then global health trips as well, that I feel really provides a unique, broad training program here in Cincinnati.
How well did the residency prepare me? Oh my gosh, so well. I mean, there's always hiccups as a new attending, but I felt very well prepared, and it's been so helpful having the connections of my faculty who answer questions all the time for me. But yes, I feel like a boss. I feel very well prepared after this residency program.
If I had to say if I felt like the Christ Hospital / UC residency prepared me well for the things that I do, I would say absolutely yes. In residency, I worked at Crossroads Health Center, which is pretty similar to what I do at the Cincinnati Health Department with regard to taking care of underserved patients, some of them who don't have insurance, and some of them who have a lot of Medicaid and Medicare insurance. So absolutely doing in residency what I'm doing now, and it really did prepare me a lot for working in Haiti as well. When I was in residency, we were still going to Honduras, and I just learned a lot about just how to figure out how to do a lot of things without having the resources.
So when I was looking at residency programs, there was a lot of things I took into consideration. One big criteria was I wanted the community hospital feel where you weren't burdened with lots of different residency programs at the same institution, but still that academic backing of a university program. And I felt like Christ really offered the best of both in that regard. Also, I felt like of everywhere I looked, the faculty here were the most dedicated to teaching and learning, many of them with their master's in education, and a real strong focus on adult learning theory and figuring out how you learn best. And really at the end of the day, that's the main reason that we're all in residency. And so that was a huge plus for me as well.
I think when you're looking at all these residencies, look around you, see how you feel like the fit is. These are going to be people you're working with for the next 3 years, and they're going to be people that, as a new attending, I realize you ask a lot of questions to each other and learn still every day from each other. So make sure it's a good fit, and then make sure you're finding people who are going to teach you a lot, because these are 3 important, very important years for learning, and you can't get them back. So as a new attending, it makes me realize like how important it is to have a really good education, and I got that at Christ. It was an awesome education.
When you apply to medical school, pretty much every medical school is going to be pretty similar, and the curriculum may change a little bit, that sort of thing. But it'll be pretty similar. But when you apply to residency, you are going to pick people who you want to be like when you grow up, because they're going to mentor you. And so when I applied to our residency program and when I came to interviewed, I felt like these are the people who I wanted to be like when I grow up, and that's where I am. So good luck to you all, and I hope to see you soon. Bye.